Module 2. Now we're really going to have some fun. How many of you have ever heard of the donut hole? No, I'm not talking about that tasty treat at Dunkin' Donuts. I am talking about the coverage gap. For those of you who have been on a group plan, this may be a new concept and it may sound a little perplexing. I'm going to explain the thresholds for you, and when I'm done, you may need to take 2 aspirin and call Extend Health in the morning. The important things to remember are, number 1, most of you will not go into the donut hole. Number 2, if you do, your benefit advisor will be able to let you know ahead of time and perhaps even provide some suggestions on how to delay going into the donut hole or maybe even avoid it altogether. So here we go. The first phase of Medicare Part D is called initial coverage. As I mentioned, most of you will spend most of the year, if not all of the year, in this phase. You will pay your deductible and copays until the total retail on your prescriptions reach $2,970, at which point you will have reached the coverage gap or the donut hole. You will now pay 47.5% towards the cost of your covered brand name prescriptions and 79% of your generics. Once you reach $4,750 for the year, you'll have reached the threshold for the third and final phase of Medicare Part D, catastrophic coverage. Now that doesn't mean that you personally paid that full amount. It's the total of what you paid and what pharmaceutical company has paid. Catastrophic coverage is designed to give financial relief to those who have extreme pharmaceutical expenses. These are 2013 figures. In 2010, those who found themselves in the donut hole had to pay 100% of the retail costs out of their own pocket. This is what caused all the commotion and the financial hardship. With the recent health care reform laws, the donut hole will gradually be phased out, shrinking between now and 2020 until it reaches 25%, more in keeping with initial coverage. Okay, so that was a lot of figures. I'm sure your head's spinning at this point. Now I'm going to give you an example of how reaching the donut hole could look, and hopefully it will make more sense for you. Let's say you take Lipitor, and the retail price on that Lipitor is $100. While you are in initial coverage, let's say that you pay $40 and your plan pays the remainder. You take some other prescriptions as well, and so sometime later in the year, say October or November, you have used $2,970 worth of prescriptions. You have paid a lesser amount because of your plan benefits, but now, instead of only paying the $40 for your Lipitor, you will be expected to pay 47.5% or $47.50, and the pharmaceutical company will pay the remaining amount. There's no carryover from year to year, and so each January you start at 0 again. As I said earlier, most people spend all or at least most of the year in the initial coverage phase. Your benefit advisor will be able to tell you if the donut hole will impact you. Okay, there you go. Now you know all about the donut hole. If you have additional questions, and I'm thinking you probably do, jot them down while they're fresh in your mind so that you can discuss your questions with your benefit advisor. You are likely wondering what are some of the popular plan options available in your area and how much do they cost. Let's look at plan availability in Shawnee County. In Shawnee County, there are 5 Medicare Advantage plans ranging from $20 to $161. The carriers are Humana and Coventry. There are 12 Medigap plans ranging from $83 for a high deductible Plan F up to $253 for the most expensive Plan F. These are through AARP and Humana. There are 16 Part D plans ranging from $15 to $108. There are many carriers for your prescription drug plan. In Shawnee County, there is a PPO with a monthly premium of $20. On this plan, you would pay $15 when you go to the doctor, $40 when you go to a specialist, and $175 copay per day per hospital stay. Emergency room is $65, and included in this Medicare Advantage plan is a prescription drug plan. You will be able to get your prescriptions, Tier 1 generics, for $6, $35 for your non-preferred generics in your preferred brand, $70 for your non-preferred brand, and 33% for your specialty drugs. You'll be able to order a 3-month supply through mail order if that's something that you would like to do. Keep in mind with a Medigap, your premium amount will vary depending on your age and gender. So the example I'm providing today is for a 75-year-old male. With a Medigap, you don't have network restrictions like you do on a Medicare Advantage plan. Any doctors or hospitals that accept Medicare will usually be happy to accept your Medigap. The premium for a 75-year-old male in Shawnee County for the lowest Medigap Plan F is $204. The prescription drug plan is $40, but you can see why we call the Medigap the pay up front plan, because once you've paid that $244, you have no deductible, no doctor copay, no specialist copay, nothing to pay when you go into the hospital or emergency room. Your prescription drug plan is a standalone prescription drug plan. You pay $7 for your Tier 1 generics, $35 for your Tier 2 generics or your preferred brand, and $71 for your Tier 3 non-preferred brand, and $33 for your specialty drugs. 90-day mail order option is available on this plan as well. In Tarrant County, there are 13 different Medicare Advantage plans, ranging from $0 up to $79 through the carriers Humana, Aetna, Coventry, WellCare, and AARP. There are 22 Medigaps, ranging from $83 up to $321 through Blue Cross Blue Shield of Texas, AARP, Humana, Sterling, Aetna, and 17 different Part D plans, ranging $15 up to $104, with many pharmacies to choose from. The Medicare Advantage plan in Tarrant County, a PPO, has a $0 premium. $15 when you go to the doctor, $35 when you go to the specialist, $195 on days 1 through 6 when you go into the hospital. Emergency room, $65. Generic prescriptions, Tier 1 at $6. $35 for your non-preferred generics and preferred brand. $70 for your Tier 3 non-preferred brand, and 33% for your specialty drugs, with a mail order 90-day plan available. A Medigap Plan F and prescription drug plan for a 75-year-old male in Tarrant County is available at $220 for the medical plan, $40 for the prescription plan, for a total of $260. And again, no deductible, no copay, no specialist, no hospital fee, no emergency room fee. Your $40 standalone prescription drug plan has a $0 deductible, so you go right into your benefits. $7 for your Tier 1 generics, $39 for your Tier 2 non-preferred generics or your preferred brand, $73 for your non-preferred brand, Tier 3, 33% for your specialty drugs. 90-day mail order option available as well. So this gives you an overview of what options are available for you in Shawnee and Tarrant counties. Your benefit advisor will be able to provide more specific details on the options available to you in your zip code. You may also look on the website. Let's talk for a minute now regarding your health reimbursement arrangement. The main thing to remember about a health reimbursement arrangement is just that it is a reimbursement. It's a tax-advantaged account used to reimburse you for your eligible health care expenses. I get the question all the time, why doesn't the company just give me a check? If BNSF just gave you a check, it would be considered income and then would become taxable. The NSF wants you to be able to use 100% of your funds towards your medical and prescription premiums. To qualify for the HRA, you must meet BNSF eligibility requirements. Keep in mind that your HRA funds will be available on January 1st, 2013. Any unused funds at the end of the year will roll over and can be used in future years. Let me explain now how your HRA works. BNSF allocates benefit dollars to your HRA account. You work with Extend Health to enroll in an individual plan. You are reimbursed for your premiums using the HRA dollars. Your account is administered by Extend Health. There are two ways to get reimbursed, the fast way and the easy way. Manual claim forms are the fastest way to get reimbursed. It takes about 2 weeks. The participant pays the plan premium or copays and then fills out a claim form attaching the required information. Extend Health verifies the receipt of the payment and eligibility, and then Extend Health reimburses the participant. This is what your claim form looks like. And be sure to sign and date it at the bottom, and then submit it, and you'll be reimbursed within 2 weeks. Now, how many of you love to do paperwork? We at Extend Health understand that. We know that paperwork is not everyone's favorite thing to do. So Extend Health offers a service called auto reimbursement. Instead of you having to submit the receipts, the insurance carrier will do it for you. Now that probably sounds better. Make sure that you ask your benefit advisor if the plan you're considering is able to offer auto reimbursement. About 90% of our plans do. It can take up to 2 or 3 months to get auto reimbursement set up. So if you need your money sooner than that, money is tight, it might be a good idea to plan on doing a manual claim for January and February until your auto reimbursement is set up with the insurance company. You will receive forms and instructions for auto reimbursement in the HRA Welcome Kit that will be mailed out to you sometime around the end of December, just before your HRA starts being funded. We've covered a lot of information. You're probably wondering, what do I need to do next? Here are your next steps. Review your enrollment guide. Gather up in a little box or basket by the phone your Medicare card, all your prescriptions, your doctor, hospital, clinic information, and any questions that you may have that you would like answers to. And have those right there handy by the phone for your appointment. The number is 855-663-4219. It's very important for you to remember that at your appointment time that you call Extend Health. Due to Medicare regulations, it has to be an inbound call. Once you get into your new plan, you'll probably have lots of questions on how to access your benefits. This is a great time for you to call Extend Health as well. We are here with direct support for you, not just during this transition period, but also ongoing. Remember, we are your lifelong Medicare advocate. We are here to help you with any claims, appeals, network questions, and so forth that you may have. Each year, during the annual enrollment period, you may call us to review any changes. If you feel the plan you are in no longer meets your needs and is not going to work well for the following year, give us a call so we can help you look at your options and make any changes that you would like to. Your spouse not yet 65? No worries. We are here when the big birthday comes around, and we are looking forward to assisting your spouse. 3 months before your birthday is when you should start receiving information from BNSF and from Extend Health and begin the process of transitioning into Medicare and selecting a plan. We find that many of our retirees have some of the same questions, so we've prepared some frequently asked questions on Module 3 that we hope will be helpful.